Yeah. Hey, I got to switch over to the MDPB meeting. You're gonna switch over with me?
I guess.
All right.
Yeah, sure.
I'll see you in a
Thanks.
second. Bye.
All right.
All right. Welcome everybody to the MDPB meeting. Waiting for all of our MDPB members to show up. If folks don't mind putting themselves on mute when they enter the room in order to the meeting, that'd be great.
Good morning.
Good morning.
Good morning. Hey, Chip. Matt, do you want to co-host me and I can help you with the waiting room?
That'd be great. Thank you.
Yep.
I'm also trying to keep attendance too, Kate, if you can help me with that.
Yep.
For folks who just joined, if you don't mind, I'm going to put everyone on mute for the time being. If you guys don't mind muting yourself on entering, just so we don't have we don't have chatter and excessive noise. That'd be great. I'm going to give our MDPB members just a few more moments to show up, and then we'll begin at that point.
I got Benji and Bethany.
I did not get Benji yet. Benji, I did get Bethany and Beth. Thanks, Kate. All right. Why don't we start up? Thank you all for joining today. This is our regularly scheduled second Monday MDPB meeting. Please remember, we've scheduled these meetings in the context of the pandemic in an effort to maintain situational awareness regarding the circumstance of the pandemic across the state and to have a rapid forum to discuss major issues. The biggest issue that I think I want to talk today and talk about today is the vaccination campaign, which is going to be beginning imminently within the state, with both vaccines hitting us in the near future. Before we get there, however, I'd like to spend our time doing our kind of common check-in with everyone of our MDPB members in an effort just to maintain our awareness of what's going on and to tease out any issues folks want to talk about. I do want to let folks know we have begun recording these events. We've been asked by others to have a recording of these events and to make those available to folks after the meeting for people who can't attend. So please know that this is being recorded, and we will be this will be available on YouTube for folks who can't attend right now. Why don't we start our check-ins with Kate, you want to start today?
Sure. So I worked yesterday and it was pretty steady for a Sunday for patients. We are seeing more COVID folks, folks that are sick with COVID, but also I think like everybody else, the other folks that are coming in that do have high acuity illness, we are still boarding some. It's not nearly as bad as it was last week, but I work at 4 today, so I'll let you know. Mondays are usually pretty busy. It seems to be kind of status quo right now.
Mike.
Hey guys, so did not work clinically over the weekend, but last week I worked a lot. I did not spend any time in our COVID unit, so I can't speak to that volume as much, but it does seem like the overall volume, overall acuity is certainly there, like Kate mentioned. We did have a couple of the days last week, as those of you that work in emergency medicine know, where it just seems like the world tilts 10 degrees to the left and everybody over the age of 80 falls down. And so we had an awful lot of those trauma transfers and elderly falls, but that's very, very common this time of year. EMS stuff lately has been a lot of vaccine questions, a lot of safety, efficacy kind of stuff. So I've been doing what I can to educate myself on all the stuff that came out for the EUA that was passed this last week. And luckily they released a lot of data, which made that very open, which was great. And then if anybody has not seen yet, there's also a New England Journal article published by the same authors that distills about 140 pages of EUA data into about 9 pages of more traditional journal article, and was a much easier read as well. And so that's where I've been when I've not been clinical, has been looking at that.
Thanks, Mike. Seth, I saw you joined.
Yep. I'm day 3 for 3 clinically. I think here our volumes are actually down a little bit. I think we're starting to see people get afraid again and not coming in unless, they absolutely need to. But we are seeing, just the same proportion of COVID cases we were, somewhere between 1/4 and 1/3 of everybody we're taking care of is COVID related. I don't know about the rest of you guys. We got onto the vaccine registry last night, and we're all picking dates for this coming week to get vaccinations. Some people are going as soon as Wednesday. I think mine's going to be Friday. Yeah, like Mike said, the New England Journal article was good. I don't think I have much else to add.
Thanks, Seth. Tim?
We're holding steady. I worked the weekend. It was fine. It was pretty tight last night on hospital beds statewide. In fact, I think towards midnight we had no beds in the state. But other than that, I think we're probably at 20 patients inpatient roughly. There was 1 on event, 4 in the CCU as of Wednesday, and then I felt it kind of go up on the coming days. And I'm looking forward this morning to finding out what our vaccination plan is for the ED. So good to hear Seth has already been able to sign up. You guys are ahead of the game. Yeah, other than that, it's pretty steady. Nothing else to report.
Thanks, Tim. Beth?
We're doing okay up here. Definitely seeing increased COVID, increased acuity, and definitely beds are affecting us, availability. Hard to get patients out, and once we do get them out, transport issues have been really common up here. I took a call yesterday about a transport from an outside hospital, just trying to get it out and maybe brainstorming about some ideas on how to transport that patient. About the vaccine, well, one of our hospitals up here in the county is getting the Pfizer vaccine. Haven't really heard anything about the distribution yet. I think our hospital is going to hold out for Moderna because we don't have an ultra cool freezer. So I guess we just wait and see on that. So about the same up here.
Thanks, Beth. Benji?
Can you hear me?
Yes.
Okay. Hey, In terms of here in the Mid-Coast, Knox County, things are definitely heating up, not in sort of critical fashion, but we're seeing an increase in volume. I think we're all kind of curious right now. The CDC report, we had our largest single day gain of cases in Knox County. They released it yesterday, I think 32 new cases one day, which for us is absolutely huge. So we're all kind of wondering if there's a new outbreak developing, but as of right now, there's no report of any outbreak at this time. But usually we've been getting 2 or 4 cases a day, and to have 32 makes you think that either the community spread's getting really bad or there's something else going on. So we're keeping our eye on that. In terms of the hospital, we're in our phase 3. We are cohorting patients now with some of the other Mid-Coast hospitals where we're basically taking the COVID patients to Penn Bay and then sending them, if we need beds, some of our non-COVID patients, post-ops and stuff like that, to go to the other hospitals. And I haven't heard too many issues of interfacility transport yet, but that's a big ticket issue. Definitely have a lot of emails about that in the past week, just trying to set stuff up and tentative arrangements with different agencies in case we end up needing that. And then obviously vaccines been big. I've been working with the local agencies here that are going to be spearheading that distribution, because that all got announced last week, and just come up with our plans. But it sounds like everyone's really got on the ball, and knock on wood, a lot of people seem pretty excited about getting the vaccine. So that's very encouraging. And I think that's really all I have in terms of updates. Thanks.
Thanks, Benji. Bethany.
Good morning. I haven't been in since last Friday, but well, just 2 days ago, I guess. But at that point, we were planning on scheduling our first vaccine clinic for tomorrow. So hopefully we'll be getting not many, maybe 150 doses for our staff, but we'll be vaccinating our ED and ICU staff primarily. But it's kind of exciting to have it arriving today and coming up from Maine Med from our pharmacy director, personally transporting it. And hopefully we'll be able to report something more official and done by Wednesday for everybody.
Great, thank you. Claire.
Things are going well. Still pretty steady as far as call volume goes. And I would say still more POI type patients. I don't know if it's more COVID positive, but definitely POIs.
Great, thank you, Claire. Did I miss anyone? I think I've captured all the MDPB members. Is that correct? Is there anyone that hasn't had a chance to speak up? All right, so I worked a couple nights last week, and I think I shared with someone that we definitely felt a little busier in our COVID unit last week. Had a lot more not just PUIs but positive cases, and just I think indicative of where we've been recently. I'll also mention that, like Bethany and others have talked about, we received notification yesterday that the vaccine would be hitting our hospital tomorrow, and signups began starting tomorrow. And so you should expect to hear a number of folks throughout the system receiving vaccines. I believe starting tomorrow might be the first day. I'm not exactly certain about that, but I think tomorrow is the first day I'm aware of in our healthcare system. So that's all very exciting news. And it really, I think vaccines are the big thing that I wanted to touch base about. And Sam and I were catching up a little bit this morning about that. Sam has been very intimately involved in the discussions with Maine CDC about vaccinations. So please recall that Pfizer's EUA was on Thursday. They released their information on Tuesday beforehand. And then the New England Journal of Medicine article that Mike referenced came out very shortly thereafter. That EUA was passed, which means the first distributed vaccine is going to be the Pfizer vaccine. That's the one that requires ultra cold storage, 21 days between doses. We know that the Moderna EUA hearing is on Thursday. I believe it's Thursday or Friday, one of those 2 days. And if the same processes from the FDA exist, then we would expect the Moderna data to be dropping sometime similarly on Tuesday, with any other associated information shortly thereafter. So a lot more information to come regarding Moderna's vaccine. Sam, do you want to share with the group the most recent timeline, any updates that you've heard of?
Sure. So good morning, everyone. I hope everyone's doing well. As many of you probably are aware, because I've seen your signatures on things, Maine EMS has been working to implement our vaccination plan for public safety. A copy of the vaccination plan should be published on the website today. I also will make sure Matt and Kate have it so that they can forward it out to each of you. What we did is we identified the top 2 to 3 EMS agencies per county based on the number of people on their roster. And then those agencies, we have asked them to be responsible for vaccinating all of public safety within their county in collaboration with the other agency or agencies in their county. All of the agencies have agreed, and we have a list of all of those agencies that is included in the plan. The agencies are now submitting applications to the US CDC to become an approved vaccination provider is what it's called. And so that agreement is being submitted directly to the CDC. EMS will likely be receiving exclusively the Moderna vaccine. And the rationale behind that is that the cold chain storage is much simpler, being that it just needs to be refrigerated. Originally, the Moderna vaccine was going to be for going to have a 7-day shelf life. They have determined that it will actually have a 30-day shelf life now. There was some confusion there. But what the latest information I've seen says it will have a 30-day shelf life in a conventional refrigerator. So that is the rationale behind EMS utilizing the Moderna vaccine, is that it will be able to hold better in just traditional refrigerators. And, the practicality of us asking EMS agencies to either acquire an ultra cold freezer or vaccinate people within a very small window, which is 5 days outside of ultra cold storage. It just makes the logistics that much more complicated. That said, EMS will be receiving the Moderna vaccine in batches. There's just not enough vaccine. We're not going to get all the vaccine we need at one push. So EMS will be receiving it in batches as soon as we receive as soon as the state receives the vaccine. Those will be dispersed amongst the agencies. Many of you may have seen that Dr. Sholl and Dr. Lambrou from DHHS published a press release that said there will be 500 vaccines available for EMS from the Moderna. That's from the very first shipment of Moderna that we will receive. EMS will get 500 off the top. And then every subsequent shipment, we will also get a portion of those, just like hospitals will get a portion for ICU nurses and those types of things. And then, so just letting you know, it will come in batches, but we will move through vaccinations as quickly as possible, because our intention is to get to 1B as quickly as possible, because that includes our drivers, that includes our firefighters, that includes our police officers, and it includes our dispatchers. So the quicker we can move through 1A, the quicker we can transition to 1B, even if some 1A activities are still ongoing with long-term care facility residents and those types of things. Our intention is to burn through our side so that we can progress as quickly as possible. The anticipated transition period that was expected or projected by the ACIP as well as Maine CDC is likely around week 5 or 6. I'm pleasantly optimistic that we will be able to make that transition a little bit earlier, because I know that EMS agencies will do everything in their power to get this out as quickly as possible. And so hopefully we'll be able to make the transition earlier. I do have concerns, as we all have kind of pointed out over time, about vaccine hesitancy. And I know that Matt will talk about this momentarily, but it will be imperative that we schedule times to talk about the vaccine in the immediate future, aka this week, this weekend, in the immediate future, that we can talk about how the vaccine works, how the approval process was done, and what this vaccine does and doesn't do. That is going to be so important so that people can make informed and educated decisions. Maine EMS, as soon as we have the information about the Moderna vaccine, as Matt alluded to on Tuesday, hopefully, we will be frantically pushing through to get educational materials assembled and put together so that we can push that out on MDPB. And we will also make a publicly available link for those organizations that don't have access to MDPB but would also like to utilize that training. When I say that, I mean like non-EMS related firefighters, police officers. That way they can educate themselves and make informed decisions for themselves, and they see the same information that we see. They have asked to be able to do that. So that is really where we are. I know that Maine CDC is also working on information campaigns. They have assembled a clinical work group. I sit on that work group with Dr. Letourneau and Dr. Sears and many of the CMOs from hospitals throughout the state. And so we will, as soon as I get more information out of that group, they will be helping to compile materials for clinicians, not only to educate clinicians, but also assist clinicians in educating their patients. A lot of that will be directed towards physicians and advanced practice providers, but they have included me because they want to also make sure that their materials are applicable to EMS. I know that EMS has been working in this field already, and that's what I've kind of told them, is that we're already down that pathway. But I certainly don't want to turn off an opportunity to collaborate. So as I get more information from them and resources from them, I absolutely will share them so that we can disperse them amongst our community and make sure that we have the most up-to-date information to share with our clinicians. If anyone has any questions about the vaccine plan, or if there's anything I can do to assist anyone, please don't hesitate to reach out to me directly. I know that everything's moving about 10,000 miles per hour right now, but please do not hesitate to reach out. And I think that's all I have to update, Matt.
Thank you for that, Sam. Any questions for Sam right now?
I think question for me is just, aside from the education and things to work with, the hesitancy, is there anything else you need from us as regional medical directors? I know you've had some service level medical directors for the services that are actually doing the vaccination, but anything else you need from us right now, or can foresee in the next week or so?
Thanks, Dr. Bohansky. The only thing I would say I need from you is that outreach. People will trust the people they know, see, and interact with on a regular basis. So if we have regional medical directors who can record YouTube videos, who can be on forums, who can interact with those services, they see you in the hospital, they know you, they hear you, and having that familiarity will convey a level of trust, you know. And so I think that will be the important part, is to make sure that as the MDPB, everyone is singing the same song and we're all singing it together. And that will be the important part, because it's going to take a lot to really penetrate the community as much as we need to. And so there will have to be a variety of options if it comes to YouTube videos that we post on our, you know, social media accounts. If it's you having, you know, you joining staff meetings. I know some of these services, especially the paid services, have staff meetings every once in a while. If you can get 10 minutes on those staff meetings to talk about it, that will be an incredible asset when it comes to discouraging vaccine hesitancy and to educate people. So that's really going to be the ask. And I know that's a huge ask because it's very nebulous, but that's what we really are probably going to need right now.
In that regard, so there's a couple of things Sam mentioned I want to just reinforce and kind of touch base and dig into a bit further. So many thanks to Kate and Sam and John Martell, who is one of our clinical colleagues, but also a Maine EMS board member who's been very interested in the vaccination and messaging around that over the last week, and including the early part of the week before we had the information from Pfizer. We started working on a talking points paper for the MDPB. This was Sam mentioned all of us being on the same page. This is our effort to inform us all so that we're all kind of working off the same information. We worked with EMS clinicians across the area and tried to gain as much information as we could about the origin of any hesitancy. And you see here that there were 5 different topics that came out, just people wanting more general information, people wanting more information about the process of the development of the vaccine, information about technology, and then safety and efficacy. And so the document is divided into those things. This is our 5th draft. There's a 6th draft that I need to look at and make sure we have a version control, but as soon as that's the case, I'll send it to you. But please know that this is a living document that really will be updated, and it'll be updated this week as soon as we get information from Moderna. I've not pushed hard over the weekend to get this updated, or last week, because of the plans to really work with our EMS clinicians having access to Moderna exclusively. But we will get this to folks for a first look and use around Pfizer in case there are questions there. But again, we'll update this again, and I'll redistribute it to folks as soon as it gets updated. So that's one thing. The other thing I wanted to touch base about is I think it's probably time for us to start scheduling those town hall meetings. In my mind, the way I had kind of envisioned this was to do this similar to the way we've done protocol rollouts, in that we schedule these, at least one large one, with as many MDPB members as we can gather, including certainly Kate and myself, the regional medical director, but whoever else can attend within each region. If we could do that in the next, as Sam mentioned, the next week to 2 weeks, which would pull us into the week before Christmas, I think that'd be very timely. As Sam mentioned, it sounds like there'll be a staged rollout of the vaccine to EMS clinicians. And even if the vaccine rollout has started, I think the chatter around that will be engaging to folks. And hopefully these will draw some level of interest amongst individuals who are wanting to talk about the vaccine and wanting to learn more about the vaccine. As far as the scheduling, please look at your own schedule. Look at your time, what time would work for you. We can use this Zoom room as far as the venue to meet, at least for these meetings. Once you've looked at your schedule and determined some times that work for you, please reach out to Kate and I, and we'll do all we can to make your schedule work for us. And again, if we could do this within the next week in particular, but we could splash over to the week after that as well if necessary. I think the only major obligation I have is the clinical shift that goes Friday from 6 to 2. So I could be available most other times around that if folks don't mind. For MDPB members who aren't regional medical directors, please attend these as well. Your voice, your input, your example is as essential as the regional medical directors. You are also a very trusted voice in your area and in the state, and the EMS clinicians, your colleagues across the state, I think would be very excited to see you there as well. So once we start getting these scheduled, I will make sure to blast out all that information to everyone so everyone can attend as many of these as possible. Again, we'll have to do this by Zoom, and I'll start working on loose agendas for those just to give us some degree of a process. Although please know that I think one of the most important pieces of these town halls is to approach folks where they're at and recognize that ultimately it is the individual's decision if they get vaccinated. And our job in these town hall meetings is to give everyone the most up-to-date, concurrent, and transparent information so they can make an informed decision about the vaccine and how they want to proceed with vaccination. Any thoughts about that right now?
I'll chat with you guys individually, but it's just scheduling will be interesting as next week is my holiday to work. So I'm working every day next week.
Let's look at this week then, Mike, or even over the weekend to see what we can do. Any other thoughts or any other concerns?
Mike, if I can, I'll look at the schedule too and see if I can help you out at all.
Yeah, cool.
Anyone else? Any other questions? Anything not related to vaccines that folks want to discuss? Sam, there's a question about what our limit on attendees in our Zoom is. Do you happen to know that off the top of your head, or Mark or Chris, do you guys happen to know?
I think it's either 300 or 500 if you use Jason or mine accounts. So we may need to schedule it with a different account because yours was not upgraded. So I think yours maxes out at 100.
Okay. So perhaps we won't use this Zoom room, but more information to come. If you guys schedule, we will get the Zoom information for you. Now, one of the things that I think we have in our favor is even though we're going to be doing these through each of the regional medical directors and their kind of geography, because we are doing it by Zoom, geography is not as important. So while Tim might schedule something in his quote unquote neighborhood, the reality is that Benji's colleagues from Region 6 don't have any logistical barriers other than time to attend. So I think we want to make sure that these are open and available to everyone, even though each of you is going to have a sort of one that you're helping us with. Please please let's advertise these wide and far so that the timing of these is not a barrier to anyone who wants to attend. Any other questions about logistics, operations, or anything else regarding the vaccine?
Matt?
Yes.
Yeah, so what I would like to do is once y'all have dates and times that you anticipate hosting these, I would love to compile that into a single list and then send that list out to all EMS clinicians and say, here are dates and times. And what I would really like to do is to use the same room for every meeting. That way, there you don't have to figure out which meeting room to go to. You can click on the link at any of those times and enter into the meeting. And so that would be my ideal situation, is to do it that way. That way we have consistency, and we make sure that what we would do is we would send it to every EMS clinician in the state as a operational bulletin. Is here are the meeting times, and here's the Zoom information. And if it means that I have to make myself available to at least start every one of those meetings, so be it.
Yeah, I agree, Sam. I think that's a smart way to go about it. If regional medical directors don't mind looking at their calendars today and reaching out to Kate and I and Sam, CC all of us on that so that we can all coordinate with you. It'd be nice to start getting these on the calendar ASAP. So please consider doing that if you don't mind.
And Matt, you want some dates in the next 2 weeks, or how far out are you thinking you want us to look?
Why don't we try to prioritize this week, knowing that the vaccine is probably there's gonna be a lot of chatter about the vaccine this week. And if the Moderna process mirrors that of Pfizer's, we can expect the vaccine to hit the state on a week from tomorrow. So if we could get these conversations going this week, and then if you don't have any availability this week, I think next week is fine as well, knowing that we're going to have a staged rollout. But let's focus on the next week with splash over into the following week. And it'd be nice to make sure we have Moderna's detailed information. So maybe starting these things on Thursday or Friday, Thursday evening, Friday. Hopefully we'll have the information from Moderna on Tuesday. We all have our MDPB meeting on Wednesday, which will consume a good amount of our time during the day. Evenings, I think, should be fair game. We should consider at least a couple of these in the evening time, a couple of these during daytime hours, et cetera, et cetera. Any other questions at all? All right, hearing none, please reach out to us if any questions do arise, any issues arise, please let us know. Please also reach out to us today to start the scheduling of these events. Thank you for all you're doing. Thank you for all the work you're doing around vaccinations in particular. I'm excited that we're taking this sort of turn. I look at this as our first attempt to go on offense against this virus. We've been playing defense for a long time, and it's our turn to pivot and turn to an offensive stance. It's also important, as Benji mentioned at our last meeting, that this doesn't mean we take away any of our current protective posture, but it means that we're moving toward a place that we could take away our protective posture. We're going to need to maintain everything we're doing right now for the intermediate term before we see the light of day. But this is a first and exciting step in that direction for everyone. So thanks for what you're doing. We'll see you all on Wednesday. Anything that arises between now and then, please reach out, and we look forward to hearing from you. Or if not before, then definitely Wednesday. Thank you, everyone.